Definitions: stomach or duodenal mucosal lesions. Peptic ulcer. Definitions: stomach or duodenal mucosal lesions. Occurrence: due to imbalance between aggressive factors and mucoso-protective mechanisms, pepsin secretion, acid secretion protective factors. Peptic ulcer. Aggressive factors: pepsin secretion, acid secretion. Protective factors: prostaglandins, E2 and I2. Mucus/bicarbonate secretion. Mucosal blood flow. Rapid turnover of gastric mucosa. Risk factors: H. pylori infections, alcohol, smoking, diet. Drugs: NSAIDs, corticosteroids. Stress. Genetic factors. Diseases: Zollinger-Ellison syndrome. Symptoms: nausea, vomiting, anorexia, upper abdominal pain. Weight loss. Heartburn. Complications: gastrointestinal hemorrhage. Chronic iron deficiency anemia. Pylorostenosis. Perforation, gastric secretions, pepsinogens, chief cells. HCl and intrinsic factor, parietal cells. Gastrin, G cells. Mucus, bicarbonate, mucus-secreting cells. Regulation of gastric secretions. Histamine, local hormone. Acetylcholine, neurotransmitter. Gastrin, hormone. Aims of ulcer treatment. Promotion of ulcer healing. Symptomatic relief of pain. Prevention of recurrence, relapse. Prevention of complications. Gastric hyposecretory drugs. Drug treatment of peptic ulcer. Gastric hyposecretory drugs. H2 receptor blockers. Muscarinic receptor blockers. Proton pump inhibitors. 2. Eradication of H. pylori infections. To prevent relapse. Drug treatment of peptic ulcer. 3. Mucosal cytoprotective agents. Sucralfate. Colloidal bismuth. Prostaglandin analogs. 4. Neutralizing agents, antacids. Gastric hyposecretory drugs. H2 receptor blockers. Muscarinic receptor blockers. Proton pump inhibitors. Decreasing gastric acidity can reduce absorption of ketoconazole and iron preparation, digoxin. Proton pump inhibitors. Mechanism of action. Irreversible inhibition of proton pump, H+/K+ATPase, that is responsible for final step in gastric acid secretion from the parietal cell. PP inhibitors include omeprazole, lansoprazole, pantoprazole. Illustration of gastric secretion by parietal cells. Pharmacokinetics: they are prodrugs, taken orally. Are given as enteric-coated capsules. They are rapidly absorbed from the intestine. They are activated in the acidic medium of the secretory parietal cell canaliculus. They are inactivated if, combined with H2 receptor blockers. Have long duration of action, greater than 12 hours to 24 hours. Once daily dose is sufficient. Bioavailability is reduced by food. Given 1 hour before meal. Are metabolized in the liver by site 450. They are more potent than H2 receptor blockers. Inhibit spatial and stimulated acid secretion. Dose reduction is required in severe liver failure. Uses. 1. Zollinger-Ellison syndrome, first choice. 2. Resistant severe peptic ulcer, 4 to 8 weeks. 3. Reflux esophagitis. 4. Eradication of H. pylori. Adverse effects. Gut disturbances, nausea, vomiting, diarrhea, achlorhydria, hypergastrinemia, gastric hyperplasia, increased bacterial flora, nitrosamine. H2 receptor blockers. Mechanism of action. They competitively and reversibly block 2H2 receptors on the parietal cells, thus reduce gastric secretion. They include cimetidine, ranitidine, famotidine, nizatidine. Pharmacokinetics. Good oral absorption. Plasma half-life, 1 to 3 hours. Duration, 4 to 12 hours. First pass metabolism, 50% except nizatidine. 100% bioavailability. Given before meals. Metabolized by liver. Excreted mainly in urine. Cross placenta and excreted in milk. Pharmacological actions. Inhibit histamine, gastrin, cholinergic drug-induced secretions. Reduce basal and food-stimulated gastric secretion. Reduce pepsin activity. Promote mucosal healing and decrease pain. Uses: duodenal ulcer, 6 to 8 weeks. Benign gastric ulcer, 8 to 12 weeks. Reflux esophagitis. Zollinger-Ellison syndrome, large doses. Pre-anesthetic medication, to prevent aspiration pneumonitis. Eradication of H. pylori infections. Adverse effects of H2 blockers. Gut disturbances, nausea, vomiting. CNS effects. Headache, dizziness, confusion, elderly, renal or hepatic dysfunction. CVS effects. Bradycardia and hypotension, rapid IV. Cimetidine has other adverse effects. Endocrine effects. Antiandrogenic actions, gynecomastia, impotence. Galactorrhea in women. Cytochrome P450 inhibitor, decreased metabolism of oral anticoagulant, phenytoin, benzodiazepines. Precautions. Maintenance dose. Relapse may occur. Dose reduction in severe renal or hepatic failure and elderly. Anticholinergic drugs. Oxyphenonium, dicyclamine. 1. Non-selective muscarinic blockers. Oxyphenonium, dicyclamine. Decreased gastric motility. Delayed gastric emptying. Heartburn. Atropine-like side effects. Pirenzepine, telenzepine. 2. Selective muscarinic blockers. Pirenzepine, telenzepine. Blocks M1 receptors on the parietal cells. Selectively inhibit gastric acid secretion. No effect on gastric motility. Less side effects of cholinergic blockade. No effect on CNS. Dose, 50 mg BID for 4 to 6 weeks. Uses: 1. Adjuvants to H2 receptor blockers. 2. Decrease nocturnal pain and peptic ulcer. Eradication of H. pylori is a bacteria that causes chronic inflammation of the inner lining of the stomach. Produce enzymes, tissue damage, inflammation, ulcer. Duodenal ulcer, gastric ulcer. Risk factor for esophagus and stomach cancers. Eradication is important to prevent recurrence of ulcer. Helicobacter pylori in association with gastric mucosa. Treatment: combined therapy is usually used. Clarithromycin, tetracycline, amoxicillin. Proton pump inhibitors or H2 receptor blockers. Bismuth compounds. Metronidazole. Resistance may develop to antibiotics. Better eradication is obtained using proton pump inhibitors and clarithromycin. Treatment: The standard first-line therapy is triple therapy consisting of proton pump inhibitors as omprosil, the antibiotics clarithromycin and amoxicillin. Omprosil duration dose regimen 2 weeks 525 mg kid 250 mg teat. Bismuth. Metronidazole. Tetracycline. 1 week. 20 mg bid. 500 mg bid. Omprosil. Clarithromycin. Amoxicillin. Week. Amoxicillin or tetracycline. Mucosal protective agents. Sucralfate. Prostaglandin analogs. Colloidal bismuth. Sucrose octaphosphate plus aluminium hydroxide. Sucralfate. Sucrose octaphosphate plus aluminium hydroxide. Mechanism of action. In acidic pH, sucralfate dissociates into its components. The negatively charged sucrose octaphosphate binds with positively charged protein molecules found in damaged mucosa, coat over the ulcer. Promote ulcer healing. Inhibition of pepsin. Stimulation of mucosal protective mechanisms, mucus and bicarbonate secretion. Kinetics. Orally, poor systemic absorption. Duration, 6 hours. Excreted in feces. Avoid co-administration of antacid or H2 blocker. Better taken on empty stomach. Therapeutic uses. Benign gastric and duodenal ulcer. Chronic gastritis. Adverse effects. Constipation and dry mouth. Interferes with absorption of some drugs: tetracycline, theophylline, tricyclic antidepressant. 2. Misoprostol. Prostaglandin analogs, PGE1. HCl secretion. Promote tight junction of gastric cells, prevent back diffusion of HCl. Mucus and bicarbonate secretion. Blood flow of mucosa, improve healing of ulcer. Kinetics. Orally, 30 minutes. Is converted into active metabolite. Excreted in urine, must be taken 3 to 4 times/day. Therapeutic uses. Prevention of NSAIDs-induced peptic ulcer. Adverse effects. Abdominal cramps, severe colicky pain. Diarrhea. Uterine contraction, dysmenorrhea or abortion. Vaginal bleeding. 3. Colloidal bismuth compounds. Bismuth subcitrate. Tripotassium dicitrate 8. Mechanism of action. It forms a precipitate with mucus, cover the ulcer with a protective coat that prevent effect of HCl. Promote healing of ulcer. Bactericidal effect against Campylobacter pylori. Decrease activity of pepsin. Mucus and bicarbonate secretion. Adverse effects. Black stool. Teeth discoloration. Encephalopathy, and renal dysfunction. Uses. Triple therapy for eradication of H. pylori. Benign gastric and duodenal ulcer. Traveler's diarrhea. Drugs that neutralize HCl, antacids. Drugs used to relieve gastric pain associated with hypersecretion of HCl. Mechanism of action. Neutralization of HCl. Inhibition of pepsin, inactive at pH 5. Therapeutic uses. Relief pain of peptic ulcer. Dyspepsia. I. Systemic antacids. Sodium bicarbonate. NaCO3 plus HCl NaCl plus CO2. Disadvantages. 1. Rebound hyperacidity. Stomach distension due to CO2 liberation, pain sensation. 3. Sodium load, salt and water retention. In cardiac patients. 4. Systemic alkalosis. Calcium carbonate. CaCO3 plus HCl CaCl2 plus H2O plus CO2. Disadvantages. 1. Liberation of CO2, stomach distension. 2. 10% is absorbed hypercalcemia. 3. Rebound hyperacidity. 4. Milk alkali syndrome, hypercalcemia, renal failure. 2. Non-systemic antacids. 1. Aluminum hydroxide gel. 2. Magnesium trisilicate. Al. O3 plus HCl HCl3 plus H2O. Advantages. Longer duration of action. Gradual neutralization of HCl, no rebound hyperacidity. Adsorbs pepsin. Minimal change in acid-base balance. No stomach distension. Disadvantages. Al. O3. Constipation. Drug interaction, absorption of tetracycline, digoxin, iron. Magnesium trisilicate. Diarrhea. CNS depression, renal failure.